All right. So today we've got Birdie Young, who was the previous director for the program. And Birdie, just if you would please introduce yourself, tell us a little bit about your nursing career and education.
Sure. Well, I am Birdie Young, and I graduated with my BSN from the University of Northern Colorado in 1974. Most of my background, early part of my career was on med-surg, primarily surgical floors. I did some in school nursing through the Cherry Creek School District over in Denver. And then went overseas, worked overseas in ambulatory care for 15 years total. I did get certified as an oncology nurse as well. And then when we returned back to the States, I was again primarily working ambulatory, retired, and my husband and I decided to come back here to the Western Slope where I grew up. And I went into the green industry and then got a call that TCR at that time, Delta Montos Tech, needed a faculty member, someone to kind of pick up some clinical teaching rotations. So I started part-time with the nursing program in 2006. Part-time soon became full-time and teaching both clinical as well as theory. Loved it all, really enjoyed it. And then when Jody retired from the college, I took over as the director, and I think it was 2010, until my retirement at the end of 2018.
So tell me a little bit about your education. I know that you went back to school, correct, during your time at TCR, is that correct?
Yes, because part of what you needed to have was a master's. They needed to have a certain percentage of master prepared nurses, which at one point in time, there were not very many master prepared nurses on the Western Slope, and the majority of them worked for TCR in the nursing program, which was fabulous back in the day. But I did go back in 2008 and completed my master's in nursing education in 2010 from Walden University.
Okay, perfect. Awesome. So the second question is, tell us a little bit about what brought you to the practical nursing program, and then the years you worked there and your roles during that time. And I know you touched on some of that. Is there anything you want to expand on?
I think, I worked into the a full-time program fairly quickly because of needing more faculty. And as faculty retired and moved on to other careers and that sort of thing, it was quite easy to move into a full-time role. When I went through my master's program, my practicum was on simulation. And so that allowed me to develop the simulation program for the practical nursing. And we had all of these mid-level mannequins, and Jody was very, very forward thinking and getting these mannequins through the Perkins funds, the funds that we would get every year. And that allowed me to be able, or allowed us to be able to expand into a simulation part of our program. At the point when I started with that, nobody really knew what to do with them because they could do so many different things. And so it was really fun to develop that part.
During your time at the practical nursing program, what were your biggest challenges? A couple of challenges, Birdie, that you would think would be number one.
Through the whole time, I think the biggest challenge was being able to keep stable faculty. I mean, we had a core group, but trying to keep faculty was difficult. And it became more difficult the further along we got into the program. It just, as the years progressed, difficulty in finding faculty was a real problem. As the program became nationally accredited, that led us into making sure, as well as the state board requirements, the qualifications that we needed for faculty. And sometimes that's hard for other people to understand why those are so important and what we needed to do to maintain that part of it.
Absolutely. Were there any other challenges that you think were up there during your time, or was it mostly just the faculty?
Clinical experiences could sometimes be a real challenge. Having 10 students on the floor at one time and trying to keep up with them all. All of our clinical sites that we used for the most part were more than willing. They were very glad to have our students there because they knew the faculty would be there with them and they didn't have to worry about what the students were doing quite so much. But when we would run across maybe something in care that we thought could have been a little better quality, the students would pick things up as, well, what about this? And what about that? And so sometimes learning to walk that tightrope between our clinical facilities, what the students were saying, and what we were trying to teach the students.
Absolutely. Absolutely. What were your biggest successes during your time at the program?
I would say my biggest success were the students. Being able to see them grow so much, so fast, and become someone that they had always wanted to be and do an excellent job of it. Many of them come in with not a lot of self-confidence in feeling like they could be successful, and having them become successful and see that they could, that was the greatest reward.
I know you guys went through the ASIN during your second accreditation and that went well.
ASIN was huge. Of course, I was with Jody when we went through the first accreditation, the initial. That was a real challenge. But Jody had a good plan for what we needed to do. And as far as I'm concerned, she went about it the right way and led the faculty through that as well. So when we had to go through the reaccreditation, I patterned it after what Jody did and what we did initially, because that was successful. And the second time it was successful as well. And learning to build those relationships with the State Board of Nursing and going to State Board of Nursing meetings, ASIN trainings, that was all huge. In addition to that, curriculum revision. We had to do, you're supposed to do your curriculum revisions every 4 to 5 years. And so working with all of the other program directors within the Colorado College community system, some were working in junior colleges as well as the three of us that were technical schools. That part was sometimes challenging because we all had different needs in our programs and what we could and couldn't do, and trying to come to a consensus and then have that approved by CCCS, as well as the college needed to review that as well. I think it was hard for people to understand or grasp all of the different governing bodies that we had to deal with. There was, of course, the school district, the college, the State Board of Nursing, ASIN, CCCS, the accrediting body for the college. And that's a huge number of different organizations that have different requirements and standards that we had to meet. And I think that gets lost oftentimes, and it's not really well understood by even by the faculty. Those of us who have been directors, as you well know, we very much know about that. But sometimes the faculty are so involved in teaching that it becomes overwhelming for them.
So thinking about your time at the nursing program, is there any positive story or a thing that stands out in your mind as kind of the best moment that you had there, or the best experience you had there?
I can think of a couple of them.
Okay, go ahead.
Well, one of our students that went through at one point in time had a learning disability, but never realized that they had a learning disability. They had always been, oh, that's okay, we'll just pass them on, we'll just pass them on, we'll just pass them on. And they came into the nursing program and we couldn't just pass them on. And after the light bulb went off that there was a learning disability, and getting assistance for that student allowed that student to become successful, pass our program, pass the state boards, went on to get a BSN. And to me, that's a huge, huge milestone. The other thing was teaching math. I never wanted to teach the math part. Dimensional analysis was like, whoa. But once I got the hang of it and was teaching the students, when I would do tutoring and see that light bulb go up, I got it. Now it makes sense. And it was all about getting them up there on the blackboard and making them do it. Those were seeing those kinds of successes in the students, and then seeing where our graduates have gone, what they've become. A lot of them have gone on to, get their BS and get their masters, become nurse practitioners. We have graduates through the years that have, gotten their PhDs. And when you think about Delta County and our small rural community, that's not restrictive. Our students were able to become who and what they wanted to be because of the foundation we gave them.
All right. Anything else? I think I'm at the end of my questions. Anything else you'd like to add?
I just think that, the nursing program was such a gem for our community. And I know it's going to be missed desperately, but I will add to that the last few years that I was director of the program, I was beginning to see, and I know you've seen this as well, a continued decline of interest within our community of people who want to go into healthcare. It just isn't what it was. We don't see that interest anymore. And I think that that's a challenge that as a community, we're going to need to really look at, and how can we instill that interest in our young people, those coming out of high school. How do you get them interested in going into a healthcare career, specifically into nursing?
Mm-hmm.